You've done everything right. You've seen the doctors. You've had the labs drawn. You've heard the words no one wants to hear. Everything looks normal. And yet, you're exhausted. You can't lose the weight no matter what you try. And your brain feels foggy. Your body feels like it belongs to someone else. You sit in the car after that appointment and you wonder, am I imagining this? I want you to hear me say this directly. You're not imagining it, and your body is not broken. But something is blocking it. And until you address that block at the cellular level, no diet, no medication, no amount of willpower is going to move the needle in a lasting way. My name is Dr. Helena, and I'm a double board certified physician in physical medicine and rehabilitation and lifestyle medicine. I'm the founder of Alliance Rehab Associates, a physician-led telemedicine practice focused on metabolic weight management and cancer survivorship. And I need to tell you something else. Something I don't say to position myself as a relatable influencer, but because it's medically relevant to this conversation. I've sat in that parking lot. I am a triple negative breast cancer survivor. I don't hide it. I have experienced what happens to your body when treatment rewires your metabolism. And I also know what it's like to not have a metabolism to begin with, the weight that won't move, the fatigue that doesn't lift, the hormonal changes that conventional medicine doesn't always have words for. I know what it feels like to be a physician who understands the science and still feel dismissed by the standard of care. So today, I want to give you what I wish someone had given me, a clear clinical explanation of what's actually happening and what it takes to address the problem at the root. Let's talk about what normal labs actually mean. When your doctor orders a standard metabolic panel, a thyroid panel, maybe a CBC, they're screening for disease. They're looking for values that fall outside a reference range, and that reference range was built on population averages. But here is what the reference range does not tell you. It doesn't tell you whether your cellular environment is optimized for function. It does not tell you whether your mitochondria, the powerhouses of the cells, are working efficiently. It does not tell you whether chronic low-grade inflammation is interfering with your body's ability to manage weight, regulate hormones, or maintain energy. I've been telling my patients this for years, and now the research is catching up. We now understand that the kind of metabolic dysfunction that causes weight resistance, fatigue, and cognitive fog can exist long before any standard lab value tips out of range. This isn't a gap in your willpower. This is a gap in what conventional screening is designed to detect. So what actually is happening? The framework I use in my practice is called mitocellular restoration, and I use that term intentionally because what we are addressing is not just weight. It is what's happening at the cellular level that makes weight management so difficult for so many of my patients. Weight is just a symptom. There are 4 root drivers that I look at. Number 1, cellular inflammation, which is chronic systemic inflammation. It changes how your cells respond to insulin, to leptin, the hormone that signals fullness, and to virtually every metabolic process that governs body composition. Number 2, mitochondrial dysfunction. Your mitochondria are the energy factories inside your cells. When they are not functioning optimally, your body becomes less efficient at burning fuel. When they are not functioning optimally, your body becomes less efficient at burning fuel and more efficient at storing it. This is not a motivation problem. This is a cellular function problem. Number 3, hormonal imbalance. And I'm not just talking about estrogen and progesterone. I'm talking about cortisol, thyroid function, insulin sensitivity, leptin resistance. These hormones don't operate in isolation. They talk to each other. And when the conversation breaks down, so does your metabolism. Number 4, gut dysbiosis. The research on the gut microbiome has been expanding rapidly, and what it keeps telling us is this: the composition of your gut bacteria directly influences how your metabolic foundation. The composition of your gut bacteria directly influences your metabolic foundation, how you process carbohydrates, how you process carbohydrates, how you regulate inflammation, and even how your hormones are metabolized. Now, here is what matters for you. If you have been struggling with your weight your entire life, or if your weight changed dramatically after a medical event, after cancer treatment, after menopause, or after a medication change, there is almost certainly more than one of these drivers at play. And no single intervention, no diet alone, no medication alone, addresses all 4. That is why the standard approaches haven't worked. Not because you failed them, but because they were not designed for your biology. Now, I want to speak directly to 2 groups of women right now, because both of you need to know that this conversation is for you specifically. The first group, women who have struggled with their weight their whole lives, women who've tried every diet, women whose weight is complicated by PCOS, which has now officially been renamed PMOS, polyendocrine metabolic ovarian syndrome, women who've been plagued by insulin resistance, by hypothyroidism, by medications they cannot stop taking, by a body that simply won't respond normally and has never responded normally. You have been told that you are not trying hard enough. You've been given the same advice that doesn't work, and you've been told to try harder. I want you to hear this. The science now supports what your body has been telling you all along. Your metabolic environment requires a different approach, one that addresses the cellular foundation and not just the calorie math. And then there's a second group of women I'm talking to, cancer survivors. Women who came through treatment, through chemotherapy, through hormone therapy, through surgery and radiation, and found a body that they didn't recognize on the other side. The weight that appeared out of nowhere, the fatigue that the oncologist said should be gone by now, the metabolic and hormonal changes that nobody warned you about, that don't have a name on most intake forms. What you are experiencing does have a name, Chemopause, and treatment-related metabolic dysfunction. And it is one of the most undertreated consequences of cancer survival. I sit in both of these chairs. As a physician, I treat both of these women every week. As a patient, I have been both of these women. Your experience is real. Your biology is real. And it deserves a clinical response, not dismissal. So what does mitocellular restoration actually look like in practice? Well, it starts with a comprehensive assessment, not just a standard metabolic panel, but a thorough evaluation of your full hormonal picture, your inflammatory markers, your metabolic health, your gut function, your body composition, not your weight, your body composition. There is a critical difference. And from there, we build a plan that addresses all 4 root drivers simultaneously. For cellular inflammation, we use evidence-based nutritional interventions, anti-inflammatory dietary patterns, targeted supplementation, and lifestyle medicine approaches to sleep and stress that directly modulate inflammatory pathways. For mitochondrial function, we use resistance training and specific nutritional protocols proven to support mitochondrial biogenesis, literally the creation of more efficient energy-producing cells. For hormonal balance, we do the diagnostic work to understand exactly where the dysfunction lives, and we build a targeted plan that may include hormone therapy, metabolic medications, or both, depending on what the patient's biology actually needs. For gut health, we use a food-first approach informed by current microbiome research And we address dysbiosis directly before expecting any other metabolic intervention to produce lasting results. And for many of my patients, particularly those dealing with significant weight resistance or post-treatment metabolic dysfunction, we also evaluate whether GLP-1 receptor agonists are appropriate. These are not magic pills. They do not work in isolation. And yes, pill forms are available if you haven't heard, and they are effective. But these meds are used as part of a comprehensive metabolic restoration plan. They can be clinically meaningful tools if used as indicated. But what we do not do is tell you to eat less and move more and come back in 3 months. We work with your body, and we also have natural alternatives such as thinner, which are available. Now, I want to paint a picture for you. Imagine going through a day and not spending any of it at war with your body. Imagine having the energy to do what matters to you. Not the energy you manage on caffeine and willpower, but real sustained energy that doesn't collapse at 3 in the afternoon. Imagine understanding for the first time why your body has responded the way it has, and having a clinical team that takes that seriously. That's not a dream. That's what happens when you address the metabolic foundation instead of just managing symptoms. If that's what you're looking for, I want to invite you to take the first step. I have a weight loss roadblock quiz that will help us identify exactly which of the 4 root drivers is most at play in your biology, so that when we talk, we are not starting from scratch. We're starting from your specific picture. Comment the word quiz below or find the link in my bio. It takes about 5 minutes and it could change the direction of your health. You have spent long enough being told you're fine when you know you're not. Take care of yourself. You deserve real answers.